Welcome back to the Holistic Health Bites podcast, where we discuss all things metabolic health. Today, we are discussing a powerful study published in the journal Diabetes on a unique approach to managing obesity and type 2 diabetes. This particular study evaluated the effectiveness of a nutrition therapy known as protein-sparing modified fasting. The first interesting tidbit about this study was that it was published in 1976. So this is not new information. Sadly, it has not been widely utilized in the era of modern medicine as we've become much more reliant on quick fixes, medical procedures, and pharmaceuticals. But stick with me because this research still holds valuable insights today and is still practiced by some people. Fasting has long been used as a natural way to lose weight, fat, reduce blood sugars, and insulin, as well as for many medical procedures. A lot of times your doctor will ask you to fast before testing or surgeries or various procedures. So it's not inherently dangerous when done properly, but it can be difficult for some people to fully eliminate all foods and beverages other than water. And most of us can really only fully fast for so long before nutrient deficiencies set in, hunger takes over, and all of the other problems that come in when you're not eating. Although some people find that their appetite actually decreases when fasting. I personally find that that's true. Protein-sparing modified fasting, or PSMF, is fasting from carbs and most fat, but is still providing nutrients in the form of protein. Specifically, in this study, they looked at egg whites and lean beef. The researchers looked at 7 obese adults with type 2 diabetes who were taking insulin. These patients were put on this special diet that included 1.2 to 1.4 grams of protein per kilogram of their ideal body weight. They could have as much water as they wanted, and they were also given a vitamin and mineral supplement. And that's it. They had no carbs, they had no fats other than what naturally was found in the lean beef. They just had protein, water, and vitamins. So let's run through each patient in this study because they're all just a little bit different. So the first patient was a 47-year-old female who had been morbidly obese most of her life and had been diagnosed with type 2 diabetes 11 years prior. She weighed 334 pounds at the outset of the study, and she was 5 foot 10 inches tall. She was taking about 52 units of insulin every single day. On this plan, she was given 150 grams of protein per day, and her insulin was progressively reduced. She started at 40 units for the first 3 days, and then 20 units for the next 4 days, and then 10 units for 11 days, and then by day 18, her insulin was no longer needed. She was also down about 25 pounds in that time frame. In a year, she ended up losing 162 pounds. Patient 2 was a 63-year-old female with obesity for over 40 years. She had been diagnosed with diabetes 6 years prior and also had a history of cardiac arrest. She was on about 100 units of insulin at the outset of the study and weighed 214 pounds at 5 foot tall. At the beginning of the study, she was given 75 grams of protein with 25 grams of carbohydrates for the first 5 days, and then her insulin was reduced to a total of 80 units, then 40 units after 9 days, and then discontinued after 10 more days. She lost 15 pounds in the first 3 weeks. Ultimately, she wasn't very compliant with the protein-sparing modified fasting plan, so she ended up requiring some oral diabetes medications. 3 months in, she now weighed 182 pounds, so down 32 pounds. Her protein dose was decreased just a little bit to 65 grams per day, which brought her glucose down into the normal ranges within 3 days. She stopped the oral medication after 6 days. At the 1-year mark, despite not really being all that compliant with the diet, she weighed 138 pounds with only slightly elevated blood glucose levels at 109. Patient 3 was a 60-year-old female, obese for 34 years, and had been diagnosed with type 2 diabetes for 11 years, and subsequently had suffered a transient drug-induced kidney failure episode, which caused her to need the insulin. She was on 55 units of insulin, which was poorly controlling her glucose levels. She had multiple other health conditions, including heart disease, gout, prior heart attack, hypothyroidism, and had previously had a hysterectomy and her gallbladder removed. She weighed 226 pounds at 5'3". She began the protein-sparing modified fast at 99 grams of protein per day, and her insulin was stopped simultaneously. At 15 days, she was down 6.6 pounds, and at 10 months, she was down 83.6 pounds. Patient 4 was a 55-year-old male with mild obesity and a colostomy after an abdominal gunshot wound. He had been diagnosed with diabetes 5 years prior and was requiring insulin at 30 units per day. He also had severe hypertension, heart disease, and gout. He started at a weight of 275 pounds and was 5 foot 11 inches tall. He began with 125 grams of protein per day, and his insulin was reduced to 20 units per day and then discontinued after 4 days. In 18 days, he was down 22 pounds and had reduced his blood pressure medication. At home, he was not very compliant with the diet and had regained 11 pounds in 10 weeks. He returned to 20 units of insulin as well. He ultimately needed to have another surgery related to the colostomy and went back on the diet. At 120 grams of protein daily, he went back off of the insulin and lost 41.8 pounds in 6 weeks. Following the surgery, he once again was not compliant and regained to 207 pounds and required the insulin again. Patient 5 was a 49-year-old female, obese since childhood, and had been diagnosed with diabetes 8 years prior. She was on 10 regular units of insulin per day and 90 units of intermediate-acting insulin per day. She also had peripheral neuropathy, hypertension, and high cholesterol. She weighed 206 pounds at 5 foot 5 inches tall. She started off with 73 grams of protein daily and steadily decreased her intermediate insulin doses, and her hypertension medication was stopped. At 4 months, she was down 39.6 pounds off of all of her insulin and maintained that weight loss for the following 6 months. Patient 6 was a 60-year-old female, obese since childhood. She had been diagnosed with diabetes 23 years prior. She was currently on 25 to 30 units of intermediate-acting insulin per day. She had hypertension, had her gallbladder removed, and subsequently got hepatitis from that surgery, and also had a prior heart attack. She began the study at 156 pounds at 5 foot 1 inches tall. She began at 80 grams of protein per day. Her insulin and hypertension medications were stopped immediately. At 2 months, she had lost nearly 20 pounds and had only regained less than 1 pound over the following 5 months. And finally, patient 7 was a 52-year-old male, obese since early adulthood, had been diagnosed with diabetes 15 years prior. He was initially on 40 units of intermediate insulin and about 20 units of regular insulin every day. He also had a history of kidney stones, kidney inflammation, COPD, prostate cancer, and hernias after his gallbladder removal. He started the study at 250 pounds and 5 foot 7 inches tall. He began with 110 grams of protein per day and reduced his insulin by 50% initially and then completely discontinued after 1 week. In 4 months, he was down 46 pounds. He ultimately was not very compliant with the diet. He ended up actually taking in more protein than was prescribed, and that was causing bigger blood sugar spikes and the need for insulin to return at 10 to 15 units of intermediate acting insulin per day. At 13 months, he was back to his original weight because he just couldn't comply with the diet. So in the end, this diet has some pretty remarkable effects. It controlled both carbohydrate metabolism and hunger. It reduced blood sugar and insulin levels. It increased the levels of ketone bodies in the blood, and it helped them get off of their medications, including insulin, oral diabetes medications, and hypertension medications, in an average of just 6.5 days. Now, you may just be wondering, isn't this just another crash diet that will wreck your muscle mass and ruin your metabolism? Well, that's the truly fascinating part about this study. Throughout this study, the researchers also monitored nitrogen balance. And we get our nitrogen from proteins, from amino acids. And they found that these patients could maintain their nitrogen balance, which is a key indicator of preserving muscle mass when following this diet properly. Of course, this was a small study conducted many years ago, but it raises some intriguing questions about how we approach weight loss and diabetes management. Could a high-protein, low-fat, low-carb nutrition plan be useful for some patients? It absolutely is an option. Now, I personally don't recommend that this be a long-term strategy as described, but I do strongly believe that this can be a tool in the toolbox to make significant changes in your health, just like a well-formulated ketogenic, low-carb, or carnivore plan can be. My main concern with the protein-sparing modified fast long-term is actually dropping too much body fat. Body fat is not the enemy, as it actually is essential to health. We don't want too much body fat, and we don't want it in the wrong places, like surrounding our organs, but we also don't want to be too lean. There's a whole host of health challenges that come when we become too lean. Fat is active tissue that serves many purposes throughout the body. Many of the current proponents of this style of eating, and there are many, are actually excessively thin, which will likely bring some long-term consequences. So I don't think this is necessarily something that should be done every day long-term beyond achieving a healthy weight, but they do have tremendous health benefits when used appropriately. Now, the researchers in this particular study did note that when protein intake got too low, nitrogen balance was no longer maintained, which would indicate that they were losing lean tissue or muscle. And when the protein was too high, especially in those with type 2 diabetes, their blood sugar levels started increasing, which required bringing back medications. So this perfect protein amount is really going to vary from person to person based on each person's unique metabolism and their health status. So, as always, it's recommended that you work with your healthcare team or an expert on this type of nutrition therapy to ensure safety, especially when it comes to modifying medications. So if you're on medications, these diets can be so effective so quickly that over-medication can be a serious risk, and a life-threatening one at that. So I hope you found this information helpful. I will link up this particular article in the show notes, so if you want to read the entire thing, you can. I welcome any questions. You can actually text the show. So drop any questions you have. If you're interested in implementing a program like this, or low carb, or ketogenic, or carnivore, apply to work with me. Let's talk about your options. Let's talk about the pros and cons of all of the different options, and let's figure out the best plan for you. Until the next, be well and vibrant.